Epidermal growth factor receptor EGFR, although present in normal cells, is overexpressed and mutated in a variety of tumors and has been associated with poor prognosis and decreased patient survival. Over the past 2 decades, much effort has been directed at developing anti-cancer agents that can interfere with EGFR activity and arrest tumor growth. And the most commonly used pharmacologic approaches to inhibit EGFR signaling are small molecule inhibitors like gefitinib and erlotinib, and also monoclonal antibodies like cetuximab. Although the use of erlotinib and gefitinib have had moderate success in clinical trials in different tumor types, the use of monoclonal antibodies has had even limited to no success in cancer patients, and particularly in highly malignant brain tumors. So in this study, what we did is we created lentiviral vectors bearing bivalent EGFR-specific nanobodies and their imageable and pro-apoptotic variants. So to ultimately develop a unique target therapy for highly malignant brain tumors. When we did a co-culture sort of experiments in vitro and also in vivo, and we showed that nanobodies prevent tumor cells from proliferating, and this effect was more prominent in vivo than in vitro. We also created imageable nanobodies to understand the pharmacokinetics of stem cell produced nanobodies. We made fusions between nanobodies and the secretable luciferase. And this fusion was similar to nanobodies because it competed with EGF binding to the EGFR and resulted in inhibition of receptor activation. This imageable fusion protein allowed us to do 2 things. It first allowed us to understand how much nanobodies were released in the extracellular milieu of the stem cells, and we show about 60% of the nanobodies are released while the rest are retained within the stem cells. And then what we also did is we took this fusion protein and injected it into mice bearing EGFR expressing tumors, and we show that it specifically targets EGFR tumors in mice. And we also did a sort of side-by-side comparison where we systemically injected the nanobodies into the mice and also delivered injected stem cells at the site of the tumor. And we show that as compared to the systemic delivery, nanobodies delivered via stem cells were specific to the tumors, and the systemically delivered nanobodies were mostly in the liver and lungs and kidneys. We know that targeting EGFR is not sufficient enough to have substantial effects on tumor growth. So we also created a novel variant of EGFR nanobodies by fusing the pro-apoptotic agent to the nanobodies. So we used TRAIL, tumor necrosis factor apoptosis inducing ligand, and fused it to the nanobodies. And so what we did after this, we did co-culture experiments where we took stem cells expressing nanobody TRAIL and tested a variety of tumor cells that have varying resistance to TRAIL. About 50% of the tumor cells are known to be resistant to TRAIL. So one of the big findings of this study is that we can actually break the resistance of TRAIL in these tumor cells. We delivered fusions of nanobody TRAIL by stem cells into mice-bearing tumors that were derived from both primary patient-derived primary tumor lines and established lines, and we show significant decrease in the in tumor growth, and mice survival was significantly up. And this was in comparison to systemically delivered antibodies like cetuximab. In conclusion, this study demonstrates the pharmacokinetics and efficacy of stem cell-based EGFR-targeted therapy in GBMs and provides a unique approach with clinical implications. And I think combining these studies with our recently published studies on developing mouse models of brain tumors which mimic the clinical scenario of tumor resection and subsequent stem cell-based therapies, we envision to translate these studies in brain tumor patients in next 2 to 3 years.